Hey guys, what's going on? Dr. Kerfasi here with DFW Accident Injury Centers. And today I'm going to be going over the different types of headaches that you might experience if you suffered an injury or accident, all right? And all of these different types can be very, very common, and you may experience one or all of them for that matter, all right? So I know this drawing is terrible, but we're going to use this for today just for purposes of the video. So again, if you've been in an accident or injury, all right, usually it's a traumatic experience, and what happens is the body can lock up, okay? And when the body locks up, things start moving in ways that they normally didn't. And this can cause you immediate pain, and this can also cause you long-term, chronic, or lifetime pain if it's not treated, okay? So people that often get into accidents or injuries and they don't get treatment, it's been shown that these people can often experience pain for the rest of their lives in various ways due to that traumatic experience, okay? So again, really important to make sure we're getting these things checked out. So I'm gonna go over a couple different kinds here today, but we'll start with the first one, which is known as a tension headache, okay? And with the tension headache, this could be also caused like a stress headache, all right? And this usually, the symptoms that you usually get with this is you feel like there's a band that's just going right across your forehead, okay? And it can even go into the temple area, okay? So these stress headaches or tension headaches, you might feel like you have a sweatband on your head, just very, very tight, kind of like your head is in a vice or grip or something, all right? So this can be just from stress, from the injury, all right? This can cause a lot of pain. Not fun to deal with, okay? So that's the first one, is a tension headache, okay? We're gonna write it here, tension, all right? Now, the next one is also really common, and again, you can get all of these different types all in the same day, all right? The next one is called a migraine. Now, most people have heard of migraine headaches, and there's a couple different kinds, but migraine headaches are usually gonna affect most likely one portion of the face like that, okay? Kind of unilateral, all right? So you might have a really bad headache on your one part of your eye, okay? Sometimes you might be sensitive to light, okay? You know, you developed a headache and you just can't be in a room with a lot of lights or sound or anything like that. It's just too sensitive, okay? Very, very hypersensitive. And so this usually affects one area of the face as well as the head. So feels like a throbbing pain, okay? So that's the second one, is going to be a migraine, okay? Now, the third one is kind of similar to a couple of these, all right? But again, a lot of these symptoms can overlap. This is why making sure that you're getting treated properly will help you know, hey, what kind of headache is going on, and all those different types of things. Now, the second one, as I mentioned, if there's trauma, okay, like with whiplash or any type of other injury where the head gets jerked, or even in general, if your body's in a traumatic experience, you can still develop a headache. And that's related to the temporomandibular joint, or the TMJ joint, okay? So this is, again, TMJ, all right? And this, you have a joint here, okay, right where your jaw meets your skull bone, all right? And so this can also create a headache. Now, because it's a joint, you have pain receptors in the joint. And as a result, you can get referred pain from these joints on either side of the head, all right? So these can go up, okay? So see how you can have multiple different symptoms related potentially to a headache. You might have a stress headache and a migraine, and might have TMJ and referred pain as a result, okay? So those are the major three types of headaches that you'll commonly develop after an injury or accident. Now, the fourth one is actually on the back of the head, the back of the neck, all right? And this often is related to, like, you could call it, I don't know if you could call it a headache per se, but it's very related to head and headaches, okay? All right, and this is gonna be known as your suboccipital, okay? And this is really common because what happens is on the backside of your neck, you have these suboccipital nerves. And when you have trauma like a whiplash, okay, what happens is the muscles tighten up a lot. And this can actually cause referred pain from the back of the neck and wrap around all the way to the eye. So it wraps around the head and comes right to the eye, and it can happen on either side, all right? And so this, again, can give you headache-like symptoms, okay? Whether that's related to tension, migraine, or more. So really, really, really important. If you've been in an accident or injury, these are all really different types and important types of headaches. There's a lot of other types of headaches. You have cluster headaches, you have sinus headaches, but when it comes to injuries and accidents, these are the most common types. So if you're dealing with any of these types of symptoms, again, you're gonna get pain, you might get throbbing, you might be sensitive to light, sensitive to sound, sensitive to touch, or anything like that. This, again, is often related to headaches. And most important point is a lot of this is soft tissue related. And when we talk about soft tissue, most injuries are soft tissue related. We're talking about your muscles, your ligaments, your tendons, and your nerves, all right? So if you're having referred pain up to the head, that's because of a nerve. If you're having referred pain around the head, that can be due to nerves. And you have to remember, you have muscles all over the face as well as all over the skull, different areas and different types of muscle. So these are all related to soft tissue. So remember, if you're experiencing any of these, give our office a call. We're here to help you. Talk to you soon.